Hello, my friends. I'm Dr. Jocelyn, a urologist and men's health specialist with 5 years of clinical experience. And today, I want to talk about something most men never hear in their entire lives, not in school, not from friends, and often not even in marriage counseling or medical visits. This is a conversation that may feel a little uncomfortable at first. But if you stay with me, it can completely change how you understand intimacy, confidence, and your health as a man. Before we begin, take a second to like this video, subscribe to the channel, and share where you're watching from. I genuinely like seeing how far this message travels, from busy cities to quiet towns and everywhere in between. Now let's begin. Here is something important that needs to be said clearly. Intimacy does not retire with age. Passion does not come with an expiration date. But in my clinical experience, I see many men believe the opposite. They slowly withdraw. They assume their best years are behind them. Or they start to feel that their body is no longer responding the way it used to, so something must be wrong with them. But I want to correct that idea today, because in most cases, what men call aging problems are not just age. They are often small habits, simple misunderstandings, and patterns that can be changed once you understand what is actually happening inside the body. And that is exactly what we are going to explore today. Not in a complicated way, not in a judgmental way, but in a clear, practical medical explanation you can actually use in real life. Over the last 5 years, I have worked with men in their 50s, 60s, 70s, and even beyond. And one thing has become very clear. When men understand the biology of intimacy and not just the myths around it, everything changes. Their confidence improves, their relationships improve, and in many cases, their physical response improves as well. Because the truth is simple, the body is not the enemy. Ignorance is. So today I want to walk you through 5 important truths. 5 common mistakes I see men make again and again when it comes to intimacy, connection, and understanding the female body. Each one builds on the last. And by the end, you will see intimacy in a completely different, more informed way. But I will warn you. The first misunderstanding I am about to explain is where most confusion begins. And it surprises almost everyone I speak to in my clinic. Because many men have been silently carrying this belief for years without ever questioning it. And it all starts with something very simple, but deeply misunderstood. We continue with the next important misunderstanding that many men never openly talk about, yet it quietly affects confidence, comfort, and intimacy more than they realize. Habit mistake number 5 is believing that vaginal fluids are dirty or something to feel uncomfortable about. I want to start by correcting this clearly and medically, because this misunderstanding creates unnecessary shame in relationships. Vaginal fluids are not random or unclean substances. They are a natural biological system designed for protection, balance, and comfort. In fact, they come from several specialized structures in the body working together. The Bartholin's glands produce a smooth, lubricating fluid that reduces friction during intimacy. The Skene's glands, sometimes referred to as the female prostate, contribute additional moisture and support arousal-related lubrication. And the cervix produces mucus that helps maintain a stable and protective internal environment. When you combine these sources, what you get is not something dirty, but a carefully regulated fluid system. This fluid is mostly water, but it also contains enzymes, amino acids, minerals, and protective compounds like lactic acid. All of these components serve a purpose. They protect delicate tissue. They reduce the risk of infection, and they make intimacy more comfortable and natural for both partners. Now, I want to address something more important than biology, because the emotional impact of misunderstanding this is often greater than the physical one. When a man reacts with discomfort, rejection, or judgment toward these natural fluids, even silently, it can create emotional distance. It can introduce shame where there should be safety, and over time, it can slowly affect trust between partners. On the other hand, when a man understands that this is a normal part of the body's design, something changes in the relationship dynamic. There is more acceptance, more ease, and more emotional safety during intimacy. So the key shift here is very simple but very powerful. You do not view these fluids as something gross. You view them as a sign that the body is functioning normally and preparing for connection. Now let's move to another misunderstanding that is often whispered about but rarely discussed openly in a medical context. Habit mistake number 4 is ignoring taste and smell differences and assuming something is wrong when variation appears. This is one of the most common private questions I hear from men in consultations. They rarely say it directly, but the concern is always there. What about the smell? What about the taste? And the medical answer is actually straightforward. These characteristics are not fixed. They naturally vary from person to person and even from day to day. A major factor is diet. Hydration levels also play a role. Hormones influence changes across the monthly cycle. Stress and medications can also shift the natural profile. For example, a diet rich in fruits like pineapple or citrus fruits is often associated with a lighter, more neutral profile. On the other hand, foods like garlic, onions, coffee, or alcohol can create a stronger and more noticeable scent or taste. Hormonal cycles matter as well. Around ovulation, the fluids tend to be more neutral and balanced. During menstruation, a slight metallic note can sometimes be present. After menopause, natural lubrication may decrease and the overall profile may change due to lower estrogen levels. But what is important to understand here is this. Variation is not a warning sign by default. Variation is normal biology, just like sweat changes after exercise, or breath changes after certain foods. The same principle applies here. However, there is one important medical exception. If there is a sudden, strong, unpleasant odor combined with itching, burning, or discomfort, that may indicate an imbalance such as bacterial vaginosis or a yeast infection. These are common, treatable conditions and should be evaluated by a healthcare professional. The mistake is not noticing changes. The mistake is assuming every change means something is wrong in a negative or personal sense. Now let's continue to a more sensitive but very important topic. Now let's move into something even more sensitive, but extremely important for safety and trust in relationships. Habit mistake number 3 is overlooking safety and assuming that intimacy practices, like oral contact, are completely risk-free without understanding the medical reality behind them. This is a topic many people avoid, often because it feels uncomfortable to discuss openly. But from a medical perspective, avoiding the conversation does not remove the risk. So let's be clear and factual. In a healthy monogamous relationship where both partners are free from infections, exposure risk is generally low. The fluids themselves are primarily composed of water, enzymes, and naturally occurring protective substances. In that sense, they are not inherently dangerous or toxic, and biologically, they are not something the body treats as harmful under normal conditions. However, there is an important medical reality that must be understood. Fluids, like any other body fluid, can potentially carry sexually transmitted infections. This includes conditions such as chlamydia, gonorrhea, herpes, syphilis, trichomoniasis, and in certain situations, HIV. The risk is not random. It depends on specific factors. For example, risk increases significantly when one partner has an untreated infection. It also increases when there are open sores, cuts, or bleeding gums in the mouth of the receiving partner. Even small oral injuries can increase susceptibility. This is why medical professionals always emphasize context, not assumptions. Now, here is the mistake many people make. They assume that if there are no visible symptoms, there is no infection. But in reality, many sexually transmitted infections can exist without obvious symptoms for long periods of time. This is one of the main reasons they spread silently. So the safe approach is not fear, and it is not avoidance either. The safe approach is awareness combined with responsibility. This means regular testing when appropriate, open conversations between partners, and using protective methods in new or uncertain relationships. From a relationship perspective, honesty is not just a safety tool. It is also a trust-building tool, because when partners are open about health, testing, and boundaries, it creates a foundation of security rather than doubt. Now let's move into something that is often even more damaging than physical risk. Habit mistake number 2 is staying silent out of embarrassment. This is something I see very often in clinical practice, and it affects intimacy far more than most people realize. Couples do not usually lose connection because of a single physical issue. They lose connection because they stop talking about small changes early on. A slight change in smell, a question about comfort, a concern about safety, or even simple curiosity about intimacy preferences. When these things are not discussed, they do not disappear. They accumulate silently. Emotionally, this creates distance. One partner may feel rejected without knowing why. The other may feel confused but hesitant to speak. Biologically, the body continues to change with age, hormones, diet, and health conditions. So silence becomes a barrier to understanding what is actually happening. And over time, that silence turns into avoidance. and avoidance turns into reduced intimacy. The solution here is not complicated, but it does require maturity. It is communication. Simple, respectful, and non-judgmental conversation. Now let's move to the final and most important habit mistake. Now we come to the final and most important habit mistake, the one that ties everything together and often determines whether intimacy becomes a source of connection or emotional distance. Habit mistake number one is forgetting the emotional power of acceptance. This is not just a physical topic. It is not just about biology or technique. It is deeply connected to psychology, trust, and emotional safety between partners. Let me explain this carefully. In many relationships, men focus only on the physical side of intimacy, performance, response, and mechanical function. But what is often missed is that intimacy is not experienced only through the body. It is experienced through emotion, perception, and acceptance. When a man fully accepts his partner, including natural bodily functions and responses, it sends a powerful emotional message. It communicates safety, it communicates trust, and it communicates unconditional acceptance. From a biological perspective, emotional safety has a direct effect on the body. When a woman feels safe and accepted, the nervous system relaxes. Stress hormones decrease, blood flow improves, and natural lubrication increases more easily. So what looks like an emotional factor is actually directly connected to physical response. But there is something even deeper here. Many women carry silent insecurity about their bodies, about natural fluids, about smell, about changes that happen with age, hormones, or health. When those insecurities are met with acceptance instead of judgment, something important changes internally. Shame begins to reduce. Comfort increases, and intimacy becomes more natural and less guarded. This is why acceptance is not just a moral idea. It is a functional part of healthy intimacy. Now, let's bring everything together into practical steps you can actually use in real life. First, create space for health conversations. Talk openly with your partner about testing and sexual health as a shared responsibility, not a sign of distrust. Second, pay attention without judgment. If something changes in the body, approach it with curiosity rather than criticism. Encourage hygiene, or medical consultation when needed, but always as a team effort. Third, practice acceptance as a mindset. Remind yourself that natural bodily functions are not flaws. They are part of normal human biology. Now, I want to be very honest with you. Most men I speak to about these topics initially feel shy or uncomfortable. That is completely normal. But over time, when they begin to understand the science and communicate more openly, their relationships change significantly. Not because they became different people, but because they replaced misunderstanding with knowledge. And knowledge builds confidence. So let me leave you with this final message. Intimacy does not end with age, and confidence does not depend on perfection. What truly matters is understanding, communication, and acceptance between partners. When those three things are present, intimacy can remain strong, stable, and fulfilling for many decades. Take care of your health, take care of your communication, and take care of the way you see your partner. Because in the end, small changes in mindset can completely transform your experience of intimacy, comfort, and connection. Now, let's bring everything together and close this conversation with a clear final understanding of what truly matters in long-term intimacy, health, and confidence. If you have stayed with me this far, you now understand something most men are never taught directly. Intimacy is not just a physical act. It is not just performance. And it is not something that automatically declines only because of age. Instead, it is a combination of biology, psychology, communication, and mutual understanding. And when one of these areas is misunderstood, problems begin to appear slowly. But the important message here is this: most of these problems are not permanent, and most of them are not medical failures. They are knowledge gaps. Now let's briefly connect the key lessons we discussed. We started by correcting the misunderstanding about vaginal fluids. They are not unclean. They are a natural biological system designed to protect, lubricate, and support safe intimacy. We then explored how taste and smell naturally vary based on diet, hormones, hydration, stress, and health conditions. And we learned that variation is normal, not automatically a sign of illness. Then we discussed safety and how awareness of sexually transmitted infections is essential, even when no symptoms are visible. Because silence or assumptions do not protect anyone, but testing, honesty, and responsibility do. We then moved into one of the most common emotional barriers in relationships: silence. The fear of asking questions, expressing concerns, or discussing changes openly. And we saw how silence slowly creates emotional distance even when physical attraction still exists. Finally, we focused on the most powerful factor of all, acceptance. Because when intimacy is built on acceptance rather than judgment, everything changes at both emotional and physical levels. Stress reduces, trust increases, and the body responds more naturally and comfortably. So, what is the final takeaway? It is simple but very powerful. Healthy intimacy is not about perfection, it is about understanding. It is about two people choosing to stay informed, choosing to communicate, and choosing to support each other through natural changes that happen with time. Now, before we finish, I want you to remember something important from my clinical experience. The men who struggle the most are not always the ones with medical problems. They are often the ones who never learned how normal their concerns really are. And the men who thrive in later years are not necessarily the youngest or the strongest. They are the ones who stay informed, stay open, and stay connected with their partners. So if you take anything from this entire discussion, take this. Do not let embarrassment guide your decisions. Do not let silence replace communication, and do not let misinformation define how you view your own body or your partner's body. Instead, choose awareness, choose honesty, and choose understanding. Because those three things are what truly sustain intimacy over time. If this message helped you, share it with someone who needs to hear it. And remember, your health and your relationships are not defined by age. They are defined by knowledge, care, and connection. I'm Dr. Jocelyn, and I'll leave you with this final thought. Intimacy does not expire. Confidence does not disappear overnight. And with the right understanding, both can continue to grow quietly, steadily, and meaningfully throughout life.